Good afternoon. I'm David Summers. I'm the publisher of the Long Beach Post and Long Beach Business Journal. Our guest, our first returning guest, is Dr. Mario Molina. Thank you for joining us for our daily live chats. If you have questions for Dr. Molina, go ahead and add them to the comments thread, and we'll try and get as many questions asked and answered as we can today. I do want to set the scene a little bit about how this looks a little bit different. This is different than our normal live chats. We are socially distant from each other. We've got marks that we are apart from each other. And I just want to set the scene for this discussion a little bit today about Dr. Molina's qualifications, because qualifications really matter in discussions about where we get information. You are a medical doctor. You are double board certified in endocrinology and internal medicine, and you're the former CEO of one of the largest managed healthcare companies in the nation. So I'm going to go ahead and say that you know what you're talking about, and why is that important to listen to people who really know what they're talking about these days?
Well, you know, my father used to say that everyone's entitled to an informed opinion. And, you know, we see a lot of opinions nowadays people put out there on social media. But, you know, how do we know who to believe? And what are their qualifications? And what are the sources of information? How do you back up the things you say? Is it just an opinion? Or is there really some substance behind it? I think that's important. People need to think about that because it's so easy just to put things out into the world on social media, and we have a responsibility to sort through all that. Think for ourselves.
You were one of our first live chat guests early on in the coronavirus pandemic. And looking back at where we are now versus 5-6 weeks ago when you joined us originally, what have you learned? What have you noticed about how this has evolved? What's new that we should really focus in on today versus 5-6 weeks ago?
Well, I think we know more about the virus today than we did a few weeks ago. We know more about how it's spread. I think that, you know, at the time, everyone was afraid, and we're trying to sort this whole thing out, and people were being very cautious. The danger is that we get a little bit too used to things, and maybe we are not as cautious as we were. You know, I think that one of the things people need to understand is how people get this infection, this virus. The two things that are really important are duration and proximity. You have to be in close contact with someone and for a fairly prolonged period of time to get it. You're not going to get it through casual contact at the grocery store, at the pharmacy, walking down the street, or in the park. By the same token, if you're in a movie theater, if you're in a sports arena where you're close to other people, those are dangerous situations. I think that if you look at where people have really gotten infected, we've seen a lot of infections. It's prisons, it's nursing homes, and it's the meatpacking plants. And the three things those have in common, or the two things those have in common, people are in close proximity for long periods of time.
The types of social media posts that we're seeing lately, there's been a lot of comparisons that this is no worse off than, say, the seasonal flu. Is that a valid comparison, or do we not know enough about the coronavirus, this particular coronavirus yet? Is this like the seasonal flu?
No, this is, I think, far worse than the seasonal flu. And perhaps the estimates of the death rates were overestimated to begin with. But as we've done more testing, the number of cases has grown faster than the number of deaths. So, you know, at first we thought that maybe the mortality rate was 3, 4, 5%. It's come down, and probably the overall mortality rate maybe is 1%. But you have to remember that the flu is 1/10 of 1%. If you look at Sweden, which is getting a lot of attention right now, about 10% of the people or more who get infected or who have documented infections are dying. So this is a serious, deadly virus. It's not something to play with.
I want to remind everyone that's watching that you can send in questions live through the comment sections, and we'll try and get as many of those asked and answered as we can. We're starting to get a couple questions in from our viewers and readers. One question is around mass testing. What are the challenges that communities face around mass testing? And then also, what's your opinion about all the discussion around antibody testing?
So let's talk for a minute about testing. Early on, the biggest barrier to testing was just the lack of testing materials. And it was interesting because one of the places that made a lot of the swabs that were used in testing was Northern Italy. And of course, because the pandemic hit Northern Italy especially hard, it was hard for people to go to work and make those swabs. One of the biggest barriers has been just the lack of testing materials. We are now testing about 2 million people a day in this country, which is a big improvement. We need to do more. The other thing is the tests are cumbersome because these tests are based on RNA, nucleic acid tests, and they're not easy to do and they take time. So we don't really have rapid turnaround tests and rapid throughput, but we're getting there. So it's getting to the point where if you want to test, you can get it. A few weeks ago, if you wanted to test, it was pretty hard to get it, even if you were sick and clearly needed it. Now, the nucleic acid tests are used for diagnosis. They will tell us if you're infected. The antibody test will tell us if you were infected. It takes several weeks to develop antibodies. So using antibodies as a test to tell if you're infected right now is not very helpful. You can be infected, and it might take 2 weeks for the antibodies to show up. What the antibodies will tell us is if you've been infected in the past. We don't know how much immunity that confers. For things like colds and coronaviruses, there's some feeling that the immunity might last for a few months to a couple of years. It's very different than things like a measles vaccine, which lasts for decades. So there's some concern that just being infected and having some immunity doesn't give you total protection. The other thing to know about coronavirus is that it appears that immunity is strain specific. So you can be immune to one strain of the coronavirus and not another. And that's one of the issues with antibody testing. You may have antibodies to a coronavirus, but not the coronavirus. So it's really important that as we do these tests, we make sure we can sort those things out.
There's been a lot of headlines over the last week or so coming out of places like Michigan, some of our neighboring cities down in Orange County around Huntington Beach, about people that are ignoring the social distancing recommendations. Is that dangerous? What's your opinion about what people are choosing to do and not do at this point?
It is dangerous, and it's dangerous because we don't have a treatment, we don't have a vaccine, and the best thing you can do to protect yourself is stay away from other people. People say, well, it hasn't been as bad as we thought. Maybe not, but it's still pretty bad. People are dying, and it's like when people would come to me and say, hey, my blood pressure is fine, doc. Why do I need to take this medication? Well, your blood pressure is fine because you're taking the medication. And if you go back 6 months and remember when you weren't taking it, what your blood pressure was like was pretty high. Same thing here. The social distancing has really helped decrease the spread of the virus. And the reason we did that was so that the hospitals wouldn't be overwhelmed as they were in New York. To give you an example, I talked to somebody in New York. They had a 15-bed unit where they could treat corona patients. They had 85 patients in that 15-unit ward. They had people in the hallways, on cots, wherever they could put someone. That's how overwhelmed the healthcare system was in New York. Now, the number of cases has gone up. It seems to have stabilized here in California, but it's because of what we did, not in spite of what we did.
You and I were speaking a little bit at the beginning about kind of the difference between medicine and public health, and why universities will have a medical school and a public health school. Talk to us a little bit about the importance of public health, about the work of the public health officials that we're hearing from now, about how that's different than going to your family doctor or a medical doctor.
Public health was started by physicians who recognized that if you want to take care of large populations, there are certain things you need to do. And it really started in the era of infectious diseases. 100 years ago, most people died from infections. That's something we don't see anymore. It's unusual for people to die from infections nowadays. But the doctor is taking care of an individual patient. The public health is taking care of the community. The two things that have had the biggest impact on life expectancy, not only in the United States, but around the world, have been vaccinations, which prevent disease, and clean water, because a lot of disease was spread by bad water. We have taken all this for granted. We have underinvested in public health in this country for years and focused very much on medicine and medical care. But on a large scale, it's public health that saves lives. On an individual, it's medication, it's individual treatment, it's the doctor. But for huge populations like the city of Long Beach, it's really about what the health department does to make sure that we have vaccinations and we have clean water.
You spoke a little bit about vaccinations. Realistically, what's the timeline for vaccinations? Is this 6 months, a year, 4 years, 5 years? What are we looking at in terms of the work ahead for a vaccination?
Well, it's hard for me to say because I don't have good firsthand knowledge of this, but when you think about the coronavirus, we've had now, this is our third pandemic or epidemic in the last 20 years, and we always are surprised. Where did this come from? How did this happen? Well, this is the new normal. I think that as we encroach on forests and animals' territories, infections that they have will jump into humans, and the fact that people can travel so quickly and so readily around the world, we're going to see things spread quickly. The fact that we don't have a coronavirus vaccine after 20 years, it's a little worrisome. There's a lot of talk that we're going to have a vaccine quickly. Maybe, maybe the scientists will be able to come up with something quickly. But there are two problems. The first is that because these things are strain specific, if the virus mutates, we may find that we've developed a vaccine, but our target has moved. The second thing is safety. When you give a vaccine to people, you give it to millions and millions of people. So it's really important to be sure that it's safe. You want to make sure that we're not introducing something that is not safe. So we need to balance the rush to have a vaccine with the need to be sure that it's safe before it's released.
We're speaking with Dr. Mario Molina, who is joining us to answer your questions. If you have a question, please do add it to the comments below. Dr. Molina, you are part of the group of civic leaders being led by former Long Beach Mayor Bob Foster, tasked by current Mayor Robert Garcia to look at how we safely and meaningfully start to reopen our local economy. I understand that a lot of that work is still underway and that you may not be able to get into some specifics, but I'm wondering if you can talk at a high level about some of that work and also maybe your thoughts about some of the reopening efforts that business owners should be considering, beaches, bike paths, parks.
That's a really interesting question. So I was asked to be on this task force. Bob Foster, the former mayor, is leading the group, and it's got a broad cross-section of leaders from all phases of the community, business, labor, etc. And we were asked how Long Beach should reopen. How do we get the economy moving again? Not when or if, but how. So we have put together some recommendations. There's a letter that's gone to the mayor. But you have to remember that we're really governed by the state of California, and the law flows from there. So most of what happens, especially when it comes to timing, is going to be driven by the governor's office. And the governor's laid out, as many other governors have, certain things that have to be in place in order to open up the economy. There needs to be adequate testing. We're making big strides there. There needs to be adequate capacity in hospitals because as we loosen the restrictions, we're going to see more cases of this. We'll probably see more people having to go to the hospital. So we have to be sure that we have the capacity in the hospitals for all of this. You'd like to see the amount of infections in the community going down so that it is safer to go out. That's somewhat questionable right now. I think that one of the things you'll see is the first area that will open up are things around recreation. The governor's said, well, you can play golf. And there's some things like that. It'll make things a little easier for people. I think people will be able to go to the beaches, but we're not there yet. We're not at the point where we can just open things up and go back to normal. There's talk about opening up some businesses. But when you look at what the governor recommends, he's saying that a lot of businesses can reopen, but with curbside service. You want to buy a pair of shoes, you order your shoes and someone will bring them out to you. You want to order flowers, you call the florist will bring them out to you. So it's not going to be business as usual.
You spoke a little bit about the governor leading the way, backed by health experts, scientists. Why is that important for people to keep in mind about a city not getting so far ahead of what the rest of the state is doing? Why should we be deferring to the state versus saying we're going to go off and do our own thing?
Well, I think the most important thing to realize is we don't live on an island. What we do affects all the people around us and vice versa. So if someone does something foolish, it can impact everyone in the community. We have political boundaries. We have the boundaries of the city, we have the boundaries of the county, but we're just a stone's throw from Orange County. It's not like they are Sweden, where they're on the other side of the world. So what happens in Orange County will affect us. What we do will affect them. What we do here will affect other parts of Los Angeles County. We truly are in this together, especially as mobile as we are. I mean, I can get in my car and drive from here to Lancaster in an hour, hour and a half. And if I'm carrying the virus, I can spread it all over the county. So we really have to think about how we as a society respond. And that's why the governor's taken the lead. I think that major cities, and Long Beach is certainly one of the major cities in the state, have input into those policies. And I'm sure that the mayor is in regular contact with the governor's office. But we have to think about the greater good.
So what you're saying is the virus doesn't understand the boundary of where a city ends or a county ends.
No, the virus respects no boundaries. And you have to remember that we're dealing with biology here. So viruses are going to do what viruses do. And they're not going to stop at the city or the county boundaries. Obviously, this thing is spread all over the world. And people have been trying to do something to combat the virus with pretty mixed results.
You mentioned about the kinds of things that we're seeing in the stage 4, about it's the close proximity, and you talked about the cases at, say, Terminal Island and nursing homes. Here in Long Beach, the data show that we have a problem in our nursing homes about people bringing it in, about the proximity. What do we do for the assisted living facilities and the nursing homes on the other side of this? How do we address a crisis in those facilities?
That's a great question, and it's difficult because I don't really know the answer to that. I think that, again, it gets back to that concept of proximity and duration of exposure. If you get coronavirus, what are we going to do? We're going to send you home. If we send you home, I can almost guarantee that 2 or 3 or 4 more people are going to get sick because you're going to expose your family. One of the things we probably need to do is have places where we can isolate patients who have the infection. Get them out of the community, but also get them out of the home. And that's difficult to do, and it's expensive. But I think that's what it's going to take.
A lot of headlines lately about a second peak in the fall, a second wave. From everything that you've seen and read, what does the rest of the year look like for us?
I think we'd be very lucky if we didn't have another wave of coronavirus infections. If you look at what happened with the influenza in 1918, that's exactly what happened. There were 2 waves. And I read an interesting paper where they looked at epidemics over the last 100, 150 years. And that's what they saw. 2 things. One is they come in waves, and they often have at least 2 components. And the second thing is they tend to happen out of phase. So typically, these kinds of respiratory illnesses are January, February events, and they trail off. What they saw with these major pandemics, and there were 7 of them that they looked at, is they tended to happen a little bit out of phase. So we're having a major pandemic. It would not be unreasonable to expect a second wave, especially as we begin to loosen restrictions. We will see more cases.
You had a social media post a couple days ago about a paper, book that Wendell Holmes wrote in 1860 to physicians, and you talked about what resonates about that today. What does resonate about that today? What was that about, and why is it important today?
So I had this old paper that was written in 1860, and I hadn't read it, but it's kind of a famous paper. And I thought, I'd read this thing. So I started reading it, and I was really struck by what Oliver Wendell Holmes was saying in 1860 how applicable it was to the present day. And the first thing he started out by talking about all the people that had died in the past year. Right? So people were dying, they were dying of infectious diseases back in 1860. And then he started talking about all the things that people were doing in response to that, and how many of them were really worthless. And he cautioned everyone that to be careful of fads and fashions in medical care and treatment. And we're seeing the same thing here. People are coming out with all these crazy ideas about what might work based on very little data. The one that really comes to mind is hydroxychloroquine, which the president was touting for a while. It's pretty clear that hydroxychloroquine does little or nothing to affect the virus. And it's not like penicillin. You know, when penicillin was first introduced, they would give someone a shot of penicillin, and overnight they would improve. It was dramatic. Well, we've seen no dramatic changes with hydroxychloroquine. Same with remdesivir. Remdesivir helps, but it's the kind of thing where they had to study 1,000 patients and use statistics to see if it really made a difference. It made a small difference. It's like the treatments we have for influenza. You know, we can treat the flu, but all we do is we shorten the length of the illness. And in the flu, we shorten it by about 24 hours. With remdesivir, they were shortening the length of the illness by about 4 days. There wasn't enough data there to show that it actually saved lives. It was trending that way. But you have to remember, they gave this to 1,000 patients. This was a big study. And the differences were small, and they had to be demonstrated with statistics. Look at insulin, another great example. You know, when people were in comas, they would give them insulin, and they'd wake up overnight. Dramatic effects. The drugs that we have right now aren't giving us dramatic effects with this virus.
We're speaking with Dr. Mario Molina, is our daily live chat guest here at the Long Beach Post and Business Journal. If you have a question, we've got a few minutes left, so go ahead and add that question in to the comments, and we'll try and get them asked what we can. Dr. Molina, you are still very engaged on the national level about discussions of managed care and the industry. You talk a lot to Andy Slavitt, former administrator of the Centers for Medicaid and Medicare. Talk to us a little bit about the national conversations that you're having, about the discussions that are happening, about what the future of the industry looks like. What's happening on the national stage right now?
Well, a couple of things. I mean, the fact that visits to doctors are down roughly 50 to 60%. Doctors' practices are struggling. I think a lot of telemedicine is being done, but it doesn't get us back to where we were. I think that we're going to have to rethink our model of healthcare delivery in the future. Certainly the primary care, but it's affecting all physicians, and it's affecting hospitals to some extent. This is an interesting experiment because I think a lot of people are not getting preventive care right now because they're afraid to go to the doctor. So what does it do when you stop doing cancer screening? Are we going to see more cancers as a result? Those are some interesting questions that are coming out of this. The other thing that I want to really talk about is, you know, one of the worst things that can happen is for you to wake up one morning during a pandemic of a deadly virus and find that you no longer have health insurance. And it's got to be a pretty anxiety-provoking realization. Millions and millions of Americans have lost their jobs, and most of them got their insurance through their employer. So people are losing their health insurance. Fortunately, Congress did something to take care of this. Back in 1965, they passed the Medicaid Act. And then 10 years ago, the Affordable Care Act modified that. So people that lose their insurance coverage may qualify for Medicaid, in California we call it Medi-Cal, or Marketplace. The great thing about Medicaid is it's based on your annual income. So you could be making $60,000 or $65,000 a year, but if you lose your job in March, you may qualify immediately for coverage under Medi-Cal. Medi-Cal covers the 10 essential benefits, things like hospital use, doctor visits, prescription medications, testing. Those are all things that you need to have in the midst of an epidemic. So people need to go to Covered California's website. It's coveredca.com, and find out if you qualify. You might be surprised. And the other thing that we're probably underestimating the number of people who've lost insurance. Because if one person is carrying the family's insurance and loses his or her job, then the whole family may be uninsured. So you see one person losing their job, but 3 people may become uninsured. So I think it's really important for people to protect themselves during this pandemic and make sure they have insurance coverage. And people that have never considered Medi-Cal before might qualify. It's definitely worth checking out.
In the conversations that you've been having with people, neighbors, colleagues, is there a common piece of misinformation that you've had to correct? Is there something that you're finding is more inaccurate than others? Is there something that you're having to tamp down when you're talking with people?
The myths about this epidemic, this pandemic, change from day to day. And I think part of it is people's anxiety and part of it is social media. So false rumors spread very quickly. There were a couple of doctors up in, I think, Bakersfield, who made this very good-looking video where they were debunking all the myths. Problem was, most of what they were saying really wasn't true. And I got a lot of questions about that. And so I had to explain to people. And finally, I just started posting things about it because I got tired of answering one question after another. I thought, you know what? Let's just put this out there. There's a lot of reckless stuff being done and said. People are anxious. People are worried about the economy. I think Governor Cuomo said it the best. If your business fails, if you have to file for bankruptcy, you can always start over again. But if you're dead, you don't get a second chance. So I think that we need to err on the side of caution. We know this is going to be an uncomfortable period in our country's history. We are facing the worst unemployment since the Great Depression, but we will get through this, and hopefully we'll get through it without losing too many of our fellow citizens.
That's a good point to end our conversation today. Dr. Mario Molina, thank you for coming back and joining us again. This was one of the most popular of these discussions that we've done. I'm sure today's will be no different. Thank you for making the time and filling us in, giving us the updates. Thank you everyone out there for watching today and joining us for our daily live chats. Have a good afternoon, stay safe, and we'll see you tomorrow.